You're listening to the Mid Morning Talk on Salam Media, and on the health segment today, we are talking about an overactive bladder. And joining me on the other side is Dr. Salim Choonara, who is a urologist. So it's sometimes called OAB, an overactive bladder, the name for a group of urinary symptoms. It's not a disease, so don't panic. But if you do have some of the symptoms, then you should be concerned. Let's learn more with Dr. Salim Choonara. Assalamu alaikum, doctor.
Alaikum salam wa rahmatullah, Maryam. Thank you so much for having me again. Appreciate it.
It's always a pleasure, doctor. So, what does it mean to have an overactive bladder, and what causes it?
Okay, so basically, it's a frequent and sudden urge to urinate. That's if we could just summarize that definition medically like that. So, frequent and sudden urge to urinate that may be difficult for you to control. So, once you get the feeling to go to the toilet, you got to go very, very quickly. There are other components to that definition. So that's the basic definition, frequent and sudden urge to urinate that you can't necessarily control. And then coupled to that, we have other symptoms such as frequency, meaning going very often to toilet, urgency, where there's a sudden need to go to toilet, and what we call nocturia, or waking up at night to use the toilet at least more than 2 or 3 times per night. And also, in addition to that, there's also an extra component to that definition of what we call urgency or urge incontinence, meaning when you get the urge to urinate, it may come so quickly and so rushed that even probably before you get to the bathroom, get to the toilet, you've already leaked some urine. So that will be urge incontinence. So these are all different sort of levels and components of the definition of an overactive, or sometimes even called an irritable bladder.
Mm-hmm. And what are some of the symptoms of this condition?
Okay, so often, as I said, there's often 3 very basic symptoms, or 3 components, or 3 symptoms that define this condition, right? One is called frequency. What do we mean by frequency? Frequency meaning that you're going many times to the toilet. On an average, an individual would be able to at least wait about maybe 2, 3, even 4 hours before they really need to urinate. Obviously, depending on what your water intake is like. But let's talk about the average person, right? So frequency meaning you're going probably like every hour, every half an hour, every little while you're looking for the toilet. At least more than 8 times in a day, you need to go to the toilet. That would be frequency, right? Urgency is slightly different. Urgency would be, you'll be talking to somebody or busy doing something, and suddenly you feel like you need to go to the toilet, And that symptom is rushed. It's very urgent. Even if you try to sort of squeeze your legs or clap, as they say in Afrikaans, you just somehow can't hold it. You just have to rush to the toilet. That's urgency, right? And then the other component is called nocturia. Nocturia simply means waking up at night to go to the toilet. And again, we will even up to 2 times, we probably will regard it as relatively okay, depending on the bigger picture of the individual. But generally speaking, if you're waking up more than 2 times at night to urinate, specifically to urinate, that also would fit with the symptoms of overactive bladder. While we're on that point of waking up at night, remember, some individuals have difficulty sleeping, or they wake up for other reasons, and then when they're awake, you just go to toilet. That's not strictly what we're talking about here. The nocturia we're referring to here is where the sensation to want to urinate wakes you up, all right? That's different from you waking up for another reason and you're just going to the toilet. You see what I'm saying? Just to differentiate that point.
All right. How can an overactive bladder affect one's life?
Yeah, that's a very good question. You see patients that go through so many mental health issues just because of the overactive bladder. It leads to massive anxiety. It leads to, your quality of life is so massively affected. You even get to the point where people say, I don't go out anymore. I just want to stay at home. Because I'm afraid I can't keep looking for the toilet. I don't want to get into a car. I don't want to travel. I don't want to drink water because I don't want to urinate. So you get so many other mental health and other physical issues that spin off from your inability to control your bladder. And it's unsaid that we see patients that sit on this condition for so long, thinking, what, I'm getting older, so that's how it's going to be. That's my life. I just accept that. And really, that's not the case. And I'm sure the message will come out strong from this program today that if you have these kind of symptoms, there's still a lot that we can do. But yeah, it's a massive impact on your quality of life. without question. We see patients. The interesting thing about that question is that we have to also look at the bigger picture. Because some people have things like they have depression, they're going through anxiety, they're going through other mental health strains, and we also sometimes see that those patients that have those kind of conditions also tend to have some of these bladder irritability symptoms. Okay, obviously one related to the condition that they're suffering from, and also from the medication that one takes relating to these mental health conditions. Some of the side effects can also interfere somewhat with the function of the bladder. So they can have some varying bladder functions. So it's not terribly unusual or uncommon for urologists, or even for us to see patients that have other mental health issues that suffer also with symptoms similar to an overactive bladder. They may not have a strictly overactive bladder by definition, but they may present very similar with symptoms that are just like an overactive bladder. So that's an interesting situation we see sometimes.
All right, Dr. Choonara, I'm going to read a few myths regarding an overactive bladder. And as I read each one, I'd like you to explain them further for us. So the first one is overactive bladder is a normal part of getting older. Is this a myth or is it a fact?
Yeah, no, it's definitely not a fact. I think, one also has to balance their thought. When you get older, you expect that your body is going to change. You can't do everything you could do when you were young. And one of those organs, and I think this is where the myth becomes a problem. This is where the information gets a bit tangled up. See, as you get older, what happens is we understand this to be the case, that your bladder capacity does reduce somewhat with age. Now that your ability to hold as much as you could. Some younger people can go to the toilet maybe once a day. So they can hold the bladder so long, and you can't really do this as you get older, all right? But that doesn't mean that you just accept that, So I think there's a balance there, On the one hand, we're saying, yes, we do allow for the fact that as you get older, your capacity of bladder will become reduced. But one thing we can be certain about, it's not to the point that it gives you such terrible symptoms and such an impact on your quality of life. That's the other extreme, what I mean? So you will allow some changes, but it's not to the point where it becomes so bothersome that you have those three symptoms of frequency, urgency, nocturia daily, and you find that your quality of life is massively affected. That component is definitely not just simply a part of aging. There's often an underlying process that's causing that problem, and we can deal with those situations very, very well. I must say to you, patients that you treat with overactive bladder, for many of them, it's a life-changing experience. Honestly, it really is. It's quite remarkable to see how they just feel after that. It's just unbelievable.
All right. The next one is OAB is just part of being a woman.
Okay, so I would say it's generally more common amongst females. But again, no, why should it be that way? But that point is very relevant. And like I said, I've seen so many patients, amongst females especially, they'll sit on that condition for years. It's hard to believe that people will actually do that. It's difficult to actually accept that. But yes, you're right. Females, they just think, it's okay. I'm just know how it's going to be, and they just sit with it. Walk around with nappies, walk around with pads, change your pads, I don't know how many times per day, and accept that to be the case. But again, definitely a myth. Not that it's just simply part of males, part of females. Remember, interestingly enough, it's not that we don't see males with overactive bladder. We do. We also see children with overactive or irritable bladders. So it's not true that it's just simply something which is which is only for women and only they will be affected. It's a natural process of being a woman. No, definitely, I totally disagree with that.
All right, Dr. Choonara, we're going to take a quick break, but we will continue with these myths or facts when we return.
Head on over for the Taste with Kick. We offer something scrumptious for everyone in the family. Wraps, chicken tikka, burgers, tender grills, cocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the Taste with Kick.
Are you looking to be inspired, uplifted, and empowered? The Mid-Morning Talk Show with Nafisa Dango is here to showcase positive inspiration that will entice you to change your perspective and uplift your well-being.
The first step to recovery in any kind of situation.
We're trying to create critical thinkers, critical leaders.
What gives me passion? What brings purpose?
Change your mindset. Reach out and uplift those in need.
Is there happiness in what you're doing? So are you just...
So we need to view slavery in the context of today's terms, and sometimes we don't venture beyond our own spaces. We only stick to what we are used to.
Tune into the Mid-Morning Talk Show on Thursdays between 11 and 1 p.m. to be enticed into different spaces where we uncover the true meaning of love and positivity.
The Al Shazia Weekend Winter Sale now on. 20% off all ladies and girls abayas, 15% off all plain and branded abayas, 20% off all Samira caftans, 20% off selected kurtas. Warm up to our sizzling specials this winter. 3 days only, 11, 12 and 13 June. Al Shazia, the scarf specialist. 215 Sparks Road, Overport, Durban. Call 031 207 6462. Al Shazia.
Every morning on every news flash, I hear the sorrow of the world. It seems like everybody's lost and still trying to make sense of it all. And as I travel to and fro so many places,
it's a new beginning. It's a new era. Salam Media, humanitarian journalism.
It's 11:18 and you are listening to the Mid-Morning Talk on Salam Media, and I am chatting to Dr. Salim Choonara, who is a urologist, about the treatment, the causes and prevention of an overactive bladder. And, you know, as the saying goes, when nature calls, you can't keep her waiting. Dr. Choonara, shukran for staying on the line. Still with these myths and facts. The next one is overactive bladder is just an issue with the prostate.
Yeah, so that speaks what I was saying to you now, that overactive bladder can also affect male patients as well. And, you know, it draws to the overlap of the symptoms, you know, because remember, somebody in a male that presents with a large prostate, it is very likely that they will experience urinary symptoms. And the way we define the urinary symptom may be, like I explained to you earlier, that those three components that make up of overactive bladder, such as frequency, urgency, and also the waking up at night to go to the toilet. So in that particular case, although they have similar symptoms to what we call an overactive bladder, in that situation, it's the prostate or the large prostate that's affecting the bladder that's producing those kind of symptoms. So often we find that the minute we deal with the prostate, the symptoms settle down. You see what I'm saying? So it's not truly an overactive bladder. It's more like a secondary effect because of something that's irritating the bladder. So the patient will present with some similar symptoms, you know. So there is an overlap there. You know, we can't truly say, you know, that it's just because of the prostate or just because of that. There are multiple other conditions that present similarly to how an overactive bladder will present. You know, the symptoms are very similar. But it's important for the specialist, for the clinician, to be able to differentiate these relative components, you know, so that we can provide the correct treatment. Because remember, the point I'm making here is that the way we would treat somebody with an overactive bladder does not mean we would treat somebody that has a large prostate and overactive bladder symptoms the same way, you know. There'll be a difference in that. It's a slight overlap, but generally a slight difference. So it's not totally true and not totally untrue either, you know, but I can understand where the thought process is coming from.
All right. So, and then the next one, an overactive bladder is caused by something that you did.
I don't know what that would be that you did, but no, generally not. I mean, you know, there's always an underlying medical condition that you get that would lead to something like an overactive bladder. You know, the only thing is, like, you know, that I can think about is, you know, some of the younger children, you know, they've been misbehaving, or they've been, you know, what you find they often only use the toilet a lot more often, you know. when they're scared or they're anxious or they're worried about something, you know. So maybe anxiety definitely may play a role in that case, you know. And some people also feel very, very cold, they go very often to the toilet. So these are some behavioral changes and some things that happen that are not always easily to explain medically, but people have and experience them, you know. So I wouldn't say yes entirely to that, but maybe we can understand it from someone that's a bit tense or anxious or worried about something. They may feel like they want to go to the toilet so often as well.
Mm-hmm. Yeah, I understand the cold part because we see it a lot. It happens a lot in winter. You know, the toilets are always busy.
Absolutely, absolutely.
And the last myth or fact: a surgery is the only treatment for overactive bladder.
Yeah, that's a great question. Yeah, and you know, unfortunately, even in the 21st century, when there's so much of information around overactive bladder, we still see individuals that present to us having had surgery for overactive bladder symptoms, you know. So it's unfortunate and it's absolutely untrue, absolutely untrue. You know, the interesting thing about that question, Maryam, is that when anybody presents with, especially incontinence, because remember, the overactive bladder patient often has some degree of incontinence. And I explained earlier, this incontinence is what we call urgency or urgent incontinence, right? That's different from something called stress incontinence, where somebody coughs, laughs, sneezes, picks up something heavy, and as a result of that, they leak urine. That's called stress incontinence, right? Urgent incontinence may be a component of overactive bladder where you suddenly need to go to the toilet, you can't make it in time, so you mess yourself. That's called urgent incontinence. So they're different, right? And the treatment is absolutely different. As far as stress incontinence is concerned, often the surgical approach, or those patients may require some sort of a surgical approach or maybe some surgical intervention. Not always, but it's more likely to happen in that particular situation. When it comes to strictly overactive bladder and urgency and urgent incontinence, the role of surgery is very limited in terms of us going to cut something or lift the bladder or do something like that. The only place where we can talk about surgery, and I wouldn't even say it's surgery because there's no cutting involved. Let's think of it like a procedure, is where we would take the patient to theater and we would put a camera into the bladder to allow us to inject some Botox into the bladder as a means of treating a patient with overactive bladder that's likely not responding well to conventional medication and treatment. So, you know, that's where maybe some sort of interventional procedure may come into play. But as far as surgery is concerned, often the lay person out there understands surgery to be where the patient gets cut for some reason, or they lift the bladder up, or they put a tape inside, or whatever it may be, you know. That's how the lay person understands surgery related to the bladder or because of bladder symptoms. And that is not the case at all when it comes to strictly overactive bladder with the urgent incontinence, you know. But again, the point here is that it's important to differentiate those two incontinence situations because the treatment is so different between them, you know.
All right. Now, because there are two different types of incontinence, how would you diagnose them in order to provide the correct treatment?
Okay. So obviously the most important thing is the symptoms. And again, a good history is so critical here. You know, it's not just about examining the patient. You got to understand what the patient is trying to tell you. And sometimes people get frustrated with me because like I keep asking them, I need to be clear which one is it, what is it? Why? Because it's so important, you know. So we ask the direct questions to say, look, is it because when you cough, laugh, sneeze, and you're leaking, is that the problem? Or is it because you can't hold, you get a feeling and you can't make it to the toilet in time? You can easily differentiate those two just by simply asking the relevant questions. So you'll know whether you're dealing with stress incontinence and urgent incontinence. That's the one aspect as far as history is concerned, right? Obviously, we do go to a whole lot of other components, like what other medical problems they have. They may have a previous surgery, they may have a hysterectomy, they may be diabetic, etc. So we take all that into account as well. As far as the examination is concerned, where you again can differentiate the stress incontinence from the urgent incontinence. When we examine the individual, and sometimes some people, this is something a bit difficult for some of the female because you have to do a bit of a internal examination, and it is a bit sensitive, but you know, you've got to try to calm the patient down when you're doing that. Is that when we ask the patient to cough or sneeze or strain while they are being examined, if they leak urine during that, we know that is more likely to be stress incontinence, right? In a patient that doesn't leak, then you know there isn't really a stress component to their symptoms, you know. So the likely that you need to there's a prolapse of the bladder, or there's something that needs to be lifted, or there's some repair surgery that needs to be performed, it's more unlikely, And the other component that comes out in the examination that may point towards urgency or urgent continence, or where the bladder is irritable, is that when we do an ultrasound of the bladder, we often find that even at a low volume, a small amount of urine that's in the bladder, but the patient has an intense need to urinate, and we can measure the volume in the bladder, And sometimes we see patients even at about 100 or 150 mils, they feel such an intense need to go to toilet, where the average person would be able to go to maybe 200, maybe even 300 mils, or even slightly more, before they have an intense urge to urinate, So you can differentiate those patients objectively also from an ultrasound and understand how much of bladder volume they actually can hold, at that particular time.
All right, so Doctor, a quick one before we end. What tips and lifestyle choices and changes can we make in order to prevent overactive bladder syndrome?
Okay, so one is diet is an important component, So especially, like if you suffer from these kind of things, you need to limit your fizzy drinks, a lot of caffeine-based drinks, spicy foods as well also can definitely cause some irritability to the bladder. And then, you need to be mindful of your underlying conditions. If you're diabetic, if you've got other issues, you've got other health issues, those conditions need to be managed, whether it be anxiety, whether it be depression, whether it be diabetes, whether it be hormonal issues that you're suffering from, those things need to be dealt with. And we have to deal with the underlying condition to actually manage. So no point sitting on this thing. You have to go and see what could there be another underlying component that will change that, right? Things like, exercising regularly, good sleep as well, and a good rest. All these things are also quite important in terms of lifestyle. And then the other aspect about life is the behavioral changes. I always say to my patients that, you need to control your bladder, not your bladder control you, So you need to be able to say, look, you know what, I've just been to the toilet now. I mean, try to hold on, try to distract yourself. Sometimes we ask people to play with the earlobe or, play with your phone or do something, to distract your mind, just to get over an initial symptom. Try to train your bladder, to try to hold a little bit more. The other aspect also is the pelvic muscle exercises as well, to try to strengthen the pelvic floor. But, we don't have much time to go into that. But the pelvic floor muscle training is also more in line with the stress aspect, not the urgency aspect. Because the stress aspect is where the bladder is collapsing, it's falling down. So by strengthening the pelvic floor, you are providing better support for the bladder, So those are some of the behavioral changes that obviously do come into play. I think the important thing is watching what you take, your fluid intake, and managing your stress, managing your anxiety. If you are a tense person, if you're an anxious person, you need to manage that because your bladder is likely to take some brunt because of those underlying conditions.
And what about your water intake?
Yeah, absolutely. Especially in cases where patients are waking up a lot of times at night to go to the toilet. Sometimes you get patients that say, I drink the whole day. Even when I wake up in the morning, I drink another glass of water. It's like, it's counterproductive. Why are you doing that? I don't drink throughout the day. Instead of drinking like, I haven't drank my liter for the day, so at supper time you want to put down 1 liter of water. You're going to wake up at night to go to the toilet. It's natural. Your body is going to get rid of the water. You are going to sleep. You are not outside. You're not active. You're not perspiring. What does your body need all the water for? So I always tell my patients, drink rather regularly throughout the day. And maybe let your higher water intake be in the daytime if you know you've got problems, And then drink less towards night. Maybe at supper time, let that be your last glass, whatever you take in. And then about an hour and a half to 2 hours before bedtime, trying to limit your water intake, Empty your bladder before you go to toilet. And that also helps you. So the other thing which we talk about is constipation as well, Sort of looking after your bowel habits as well. And we do find that patients that have overactive bladder symptoms also have some issues with constipation. So often try to make sure you have a regular bowel motion, so you empty your bowels regular. All these things will do a little to try to manage your overall picture of an overactive bladder,
All right. Look after your diet, exercise, and manage your stress and anxiety. Dr. Salim Choonara, shukran so much for your time and for the advice and tips.
Zakira, thank you for having me again. Appreciate it.
Assalamu alaikum. That was Dr. Salim Choonara, a urologist, taking us through an overactive bladder syndrome, the causes, the treatments, and obviously prevention, because prevention is better than cure. One of the tips that he gave was to manage your stress and anxiety, as well as to watch what you eat. Your diet is very important. It plays a crucial role in preventing overactive bladder syndrome. It is 11:31.